So obviously from very early on, I was able to identify that there'd been failures in my son's case, where he was under the care of the acute home treatment team. And I remember, you know, I think the day after Haydon took his life, that I had contact with the mental health team, who spoke about Haydon's discharge in a very positive way. And from that moment, I instantly knew something has gone wrong here. So at that earliest opportunity, I requested all of Haydon's medical records. And once I was in receipt of those, I clearly could see huge breaches of care and duty. And from that, I began to realise that I needed to address this. There was failures, and it was not okay. So I began in that journey of trying to get legal support. I'm a mum, first and foremost, who's lost her child in the most horrific of ways, but also could see that there was huge failures. And part of that processing really was the need to address that. So I think in those early sort of weeks, it was, you know, researching, looking at websites, finding and identifying legal firms that were promoting that they supported the legal rights of families that have lost their children or loved ones to suicide. And they had huge amounts of information promoting that. However, on making contact, what I was finding repeatedly over and over was that nobody was actually willing even so much as to hear my story. I think their first questions were where that happened, and obviously from my experience that wasn't in a hospital setting, and that appeared to be an immediate shutdown of what the law would allow us to explore within any possible breaches of duty and care. So I was really just being shut down, and with every shutdown, I felt like I was being silenced. I felt powerless, and that only increases your sense of injustice, I think. So it wasn't a good experience. I actually spent for a period of, I'd say, around 6 months trying to teach myself essentially, what do I do with this? How do I vocalize this? How do I address it? Obviously, there was the inquest to prepare for. I had no legal representation until, obviously, and gratefully, Oakwood supported me. I think my initial impression was how you wanted to at least allow me to give the narrative, to explain my experience. It wasn't something that, you know, a few second conversation, as I explained, you know, it doesn't fit that criteria. So no, it was very much, let's hear you, let's look at the circumstances around this. And I think that was what defined you, apart from some of the other legal firms that I'd contacted, that I was shut down. You allowed me to have a voice at the earliest opportunity. Absolutely. I mean, I'm obviously very conscious of the legalities around how difficult a case like this is to prove that there is negligence, because as we know, Haydon wasn't in a hospital setting. However, I think what I was always given was transparency. There is difficulties here. This is going to be difficult. There are challenges, but those challenges were spoken about openly. But it was never without a desire, I believe, on Joseph Hilton's part of, I can see where those failings are, and we want to do all we can to support you in that journey. I can't promise you an outcome, but I am going to do my best to give you a voice, and for Haydon essentially not to have died in vain. I mean, obviously, Joseph has been there as my legal representation, or more importantly, Haydon's, in my mind. And we have developed a relationship in the sense that that transparency, that openness, that willing to listen, you know, always showing a level of empathy, not always something that he can address and fix for me, because some of what I bring to him is often that raw emotion, frustration, hurt, and pain. But what he's always done is held me through that, given me that realistic legal advice. So it's not making, big bold promises, but I have not doubted for a moment that, Joseph has fought my corner, definitely given me a voice. And whether that's heard in the way that we want it to be, or whether, it gives the outcome that we desired, he always, in my opinion, worked towards representing my son. I mean, when I was informed of the outcome, in regards to the clinical findings, the breach and causation, obviously, um, just I'm completely and still struggle to find the words, because there is no particular desired outcome. None of this brings my son back. However, what it does is makes me feel that I have used that grief and pain that I've experienced in a way of saying this is not okay. So for me, I've done this not for a monetary sense. For me, and part of my healing is about having a voice and standing up and saying this is not okay, and having that come to that conclusion and that outcome, for me, feels landmark. For me, it feels like actually they are admitting, through the work that Oakwood Solicitors have done, and the evidence that you've provided around all of this, that outcome, I couldn't have wished for a better outcome. Absolutely. I think one of the biggest messages that I want to promote, aside from the need for, this mental health, to be in a place where every patient or every client who is affected by ill mental health is well represented and supported. My message to other families that have sadly experienced the loss of a loved one by suicide, that might not fit into that, exact clinical criteria of being in hospital, being in custody, etc., that actually, if they are under the care of a provider that is there to help you to safeguard your loved one, and that doesn't happen, then Oakwood for me has been the only law firm that has been willing to take on such a complex case. And for that, I cannot express my gratitude more. I've gone from being silenced, distraught, powerless, to having a voice, being able to say this is not okay, and I would not have been able to do that without you guys.